The heart is mostly supplied by the two coronary arteries which arise from the ascending aorta immediately above the aortic valve. The coronary arteries and their branches run on the surface of the heart, lying within the subpericardial fibrofatty tissue. Coronary artery arises from the anterior aortic sinus of the ascending aorta immediately above the aortic valve. Course. After arising from the ascending aorta, the right coronary artery first runs forwards between the pulmonary trunk and the right auricle, and then it descends almost vertically into the right atrioventricular groove, the right anterior coronary sulcus, up to the junction of the right and inferior borders of the heart. At the inferior border of the heart, it turns posteriorly and runs in the posterior atrioventricular groove up to the posterior interventricular groove, and terminates by anastomosing with the left coronary artery. Branches and distribution. Right conus artery. It supplies the anterior surface of the pulmonary conus. Anterior ventricular branches. They are 2 or 3 and supply the anterior surface of the right ventricle. The marginal branch is the largest and runs along the lower margin of the sternocostal surface to reach the apex. Atrial branches. They supply the atria. One of the atrial branches, the artery of the sinoatrial node, supplies the SA node in 60% of cases. In 40% of individuals, it arises from the left coronary artery. Posterior ventricular branches. They are usually 2 and supply the diaphragmatic surface of the right and left ventricles. Posterior interventricular artery. It runs in the posterior interventricular groove up to the apex. It supplies the posterior part of the interventricular septum, AV node in 60% cases, and right and left ventricles. Left coronary artery. Origin. The left coronary artery arises from the left posterior aortic sinus of the ascending aorta immediately above the aortic valve. Course. After arising from the ascending aorta, the left coronary artery runs forwards and to the left between the pulmonary trunk and the left auricle. It then divides into an anterior interventricular artery, also known as left anterior descending artery, and runs downwards in the anterior interventricular groove to the apex of the heart. It then passes posteriorly around the apex of the heart to enter the posterior interventricular groove to terminate by anastomosing with the posterior interventricular artery, a branch of the right coronary artery. The circumflex artery winds around the left margin of the heart and continues in the left posterior coronary sulcus up to the posterior interventricular groove, where it terminates by anastomosing with the right coronary artery. Branches and distribution. Anterior interventricular artery, also known as left anterior descending artery. It supplies anterior part of interventricular septum, greater part of the left ventricle and part of the right ventricle, and a part of left bundle branch. Circumflex artery. It gives a left marginal artery that supplies the left margin of the left ventricle up to the apex of the heart. Diagonal artery. It may arise directly from the trunk of the left coronary artery. Conus artery. It supplies the pulmonary conus. Atrial branches. They supply the left atrium.